Okay, chapter 2 lesson, just only the one of the short about the lesson. They're about the emergency help. So I think this one is not so difficult, especially for the student that involved for the St. John and also the BBSM. Okay, this one is related with the emergency help. Okay, without any equipment. We're never using any equipment, just using our hand, okay, to help the victims. So the first one, everybody know there's a CPR. Okay, CPR, C is stand for the cardio. Okay, cardio. Then the P stand for the pulmonary. Okay, pulmonary. After that, we got resuscitation. This one is stand for the R. So the short form, we just call it CPR. Okay, so from here we go through. Okay, this one lesson, the topic name we call emergency help. Okay, let's see the CPR. Okay, from the CPR, what we need to learn? Okay, first one, we need to learn about the meaning. Okay, what's the meaning for the CPR? Okay, and also the citation, we need to apply the CPR. Okay, meaning. Okay, just now I told you the name already, the long form for the CPR. We need to apply the CPR. Not simply you want to apply. So we need to see the citation, we need to apply this one process. Okay, the second one is a demonstrate. Okay, later I will show the video clip, demonstrate to demo the CPR method. Okay, number 3, later we'll explain what is the important for the CPR. Okay, what's the important and why we need to learn about the CPR. Okay, so these 3 objectives later we need to achieve lah. Okay, now the first step sure is what is CPR. Okay, what's exactly the meaning? Okay, this was a cardiopulmonary resuscitations. Okay, the meaning, first one, emergency. They've been using as an emergency aid. Okay, and also involve combinations. Okay, the process will combine 2 things. One is a chest compression and also the breathing into the mouth of the victim. So they got 2 processes. One is a compress. Okay, number 2 is a breathing to the victim mouth. Okay, why you need to do like this? Because you want to restore the mouth of the victim, to restore the heartbeat and also the breathing. Okay, you want to let the oxygen go in the victim mouth. After that, you want to let the victim got heartbeat. So this one we need to do the 2 process for the CPR. Okay, we can see the diagram. Okay, this one's a diagram. Okay, we're using the hand to compress the chest for 30 times. Okay, fast 30 times. After that, you need to give the breath, mouth to mouth, to give the oxygen breathing to the victims. Okay, then after that, 2 rescue breathe. Okay, 2 times. And also this one, 2 rescue breaths. This one is a 1 set. So suppose need to do 5 sets. Okay, if still don't have any response, you need to keep to do for 5 sets until the ambulance to come. So this one we call CPR. Okay, CPR, the what situation we need to apply. First one, when the victim is not breathing. Okay, make sure there's a not breathing. Okay, number 2, no response. Okay, you call so many times already. Okay, they also no response. Okay, another situation is no heartbeat. So that means you need to check lah. And no breathing, no heartbeat, and no response. So you need to do. Okay, for these 3 situations, then you need to start to do the CPR. Okay, then we're going to see CPR should be performed when there is an individual, first one, unconscious, already pingsan. Okay, number 2, unresponsive, no response. Okay, although you shout so many times. Okay, number 3, no breathing. Okay, you go and check, they also no breathing or no breathing normally. They got breathe, but not normal. Sometimes got, sometimes don't have. So that means this all situation, you need to start to do the CPR. Okay, we not simply go and do. And you see the person, they're lying on the floor, then you go to do no. So you need to check. Okay, when they got this all symptom, then we start to do the CPR. Okay, then we're going to see the next part. Okay, CPR is one of the process will not require any requirement. So you don't need to take the pump lah, no need to take the tong lah, no need to take the tube lah. No, we're just using our head. Then can start to do the CPR. Okay, now you see the condition they're requiring the CPR. Okay, first one condition when heart attack. There's somebody suddenly they fall down because of heart attack. Okay, another one maybe is an electric shock. Suddenly they touch about the electric, then electric shock, then they fall down. Okay, they fainted. After that, you need to do the CPR. Next is a drowning. Okay, when they just in the water, they cannot come out. After that, when they just lift up, then after that, you need to do the CPR. Okay, and the last one should be the example, lightning strike. Okay, suddenly in the field or in the during the playing the football, they got lightning strike. Then the person fall down. Then after that, pengsan, so you need to do the CPR. Okay, this all is a process. Normally, you need to do the CPR. Okay, so for example, here you see the person, okay, they're just lying on the floor. Then maybe the situation that happened. Then after that, the first process you need to go to call the person. Don't straightforward call 999. You straightforward go to ask the person, to shout the person, are you okay? Okay, if they don't have any response, so that means you start to call the emergency call 999. Okay, after that, then you need to do the immediately you need to do something. Cannot wait the ambulance to come because it will take some time to come. So the first 4 minutes is very important. So you need to check. Okay, got breathing, heartbeat. Okay, for the person. Okay, go closer and listen for breathing or not. Then after that, you make sure that no breathing. Then after that, and also cannot talk, no response. So that means you need to do the CPR. So the first way you need to put down airway. Airway means what? You need to lift the chin up. Then lift the chin up. The head must be go down a bit flat. Must be flattened. Okay? Because let the oxygen can be go in the nose. Okay? So from here, then after that, you put the way like this, then you can start to do the chest pressing. Okay? The chest pressing. Okay? Compress the chest. Okay, this one important. Later we show more detail. How your hand to put. Where's the location you want to put? Okay, so this one is a chest compressing. Okay, next one, after your chest compress, okay, you need to do the breathing some more, mouth to mouth for the victims. Okay, this one called breathing part. Okay, after that, this process, you need to repeat 5 cycles. Okay, 5 cycles. So that means the chest compression perform 30 times followed by 2 times of the mouth to mouth. So this one we count as a 1 cycle. Okay, 1 cycle. So then after that, you need to repeat 5 until 5 cycles. So the ambulance waiting until the ambulance to be arrived. Okay, or until the victim can regain the consciousness. Okay, maybe the ambulance not yet arrived, then the victim already wake up. Okay, so if the victim already can be breathe, okay, can breathe already, so that means, but they're still unconscious, they're still pengsan, but they can breathe. So you need to change the position. Okay, the victim need to change the position to the side, turn the body to the side. Okay, so this one is one of the technique you need to know when the emergency, the situation will happen. Okay, so we go through. Okay, the procedure CPR, what you need to do. Okay, the first step, sure, we need to check lah. Check the response from the victim. So you need to shout it. Are you okay? Are you okay? So after that, number 2, you need to tilt the head back and leave the chin open, the air flow. So this one, the head put at the back, flat on the ground, lift the chin, okay, to open the airway. The airway want to go in the nose and also go in the mouth. So that's why you let it more easy to go in. Okay, after that, I mean you need to start to perform the chest compression. Chest compression of the victim 30 times. Fast 30 times. After that, this one fast, that means the rate can go until 100 and 120 pressure per minute. So that means you do very fast. Compress up, very fast, 30 times. So when you fast, then they can achieve 120 pressure per minute. After that, 30 times finish, then you need to pinch the nose. Make the nose close. Use your finger to pinch the nose close, then give the full breath, okay, of the air into the victim's mouth for 1 second per breath. Okay, 1 second per breath. Okay, so you do twice. Okay, 2 times. Okay, so this one we call 1 cycle finish. So that means the second time you need to repeat. Okay, repeat again to perform the chest compression for another 30 times, followed by the 2 full breath into the mouth. Okay, so that means you need to repeat. Okay, this whole thing is what you need to do when you do the CPR. Because emergency, the first 4 minutes that one that in front is very, very important before the ambulance to come. Okay, you want to rescue, so you need to learn how to save the victims. Okay, now you're going to see the step. Okay, here I can show you the step. Check the responsive. Okay, call, emergency call. Okay, sometimes this one is remove clothing. Normally for the men, they want to remove the clothing. What easy for the chest compress. Okay, open the airway. Open the airway means lift the chin up. Okay, check for the breathing. Give 2 breaths. Okay, this one they start with the breathing first. Or start from the compress also can, but important we start with compress first. Okay, the compressing first. Compressing first, then baru we go to breathe. Okay, this one is a step. Okay, so now I go to show this one video clip.
The first step of CPR is to assess if the person is awake or not. Are you okay? Are you okay? If there's no response, you should shout for help or send someone for help. If no one's available to help you, you must act. Time is very important when trying to save a life. The first thing you want to do is remove the clothing so that you can work. Open the airway by doing a head tilt chin lift. You want to lift with your fingers on the chin and hold the head at the forehead with your other hand. And you want to lean in and you want to look at the chest, listen for breathing, and feel for any breath against your face. And do that for about 5 to 10 seconds. If there's no breathing, you need to give 2 breaths by pinching the nose and making a seal against the mouth. You should see the chest rise with each breath that you give. The next step is to check for a pulse by using 2 fingers on the side closest to you. You should check for a pulse for about 5 to 10 seconds. And if you don't feel a pulse, you need to start with compressions. Place the heel of your hand between the nipples on the chest, right over the breastbone, and interlock your fingers together. And you should push 1/2 to 1/3 the depth of the chest. And you should do 30 compressions. 1, 2, 3, 4, 5. As a nurse, I've taken care of many children that have come to us after suffering a near drowning, and they've been pulled from a body of water and had CPR performed by family and friends. Knowing just a few basic steps of CPR might help save your child. 30. Continue with cycles of 30 compressions to 2 breaths for 5 cycles. And if help hasn't arrived after 5 cycles, you can leave the child to phone for help. When you return to the child, you should continue with compressions and breaths until professional help arrives. And remember, this is not a substitute for a formal CPR course. We urge you to sign up for a course in your community.
Okay, this one they just show about the compress.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call your local emergency response number or call it yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute.
The important for the CPR. Why we need to do so many things like this? Okay, so you can see the first important. You want to restore the victim blood circulations. So that means when you do the heartbeat, the chest, you go to press it, then you give the breathing. That means you can help the blood for oxygen. After that, they can move again into the body. Okay, number 2, you want to supply the oxygen. Because already no oxygen, the breathing cannot breathe. They don't have any oxygen already. So you help to let the oxygen to move in. Okay. Okay, so from here, number 3, we go to number 3. Number 3, you want to rescue the life lah. It's not sure lah. One person, one life, you know. So you want to rescue some more. And the next one, number 4, you want to prevent the worst cases. If you late, maybe the person, they become abnormal, they become cacat, like this. So that's why you need to help. For the first 4 minutes is very important for the victims. Then after that, we go number 5. Number 5 is to help in the temporary healing process. Okay, the temporary, that means the ambulance before they come, that means you just help in front, let the person still can stay there first. Okay, before they wait the ambulance to come. So this one is some of the emergency help. Okay, and also not so very hard. You don't need to using any equipment. So you're just using your knowledge to help somebody. Okay, so this one just now we saw already. You want the hands only for the CPR. Okay, just now is one of the method that's about the CPR. Okay, now we do the second method. Second method, we also can be helped without any equipment. So this one we call hemorrhage maneuver. Okay, hemorrhage maneuver is the process when you do when somebody is choking. Choking means something tersangkut. Okay, dalam you punya kelongkong. Okay, in your trachea, something you eat, the food you cannot digest. Okay, after that there's quite big. After that they're blocking at the trachea there, I mean the mouth inside there. Okay, they cannot go down. So from here, this one, the process, you need to learn how to help the person when the situation like this. This one also is one of the emergency situations. So from here, we can see. Okay, remember how to spelling the word hemorrhage maneuver. Okay, you see the diagram. Okay, you see the diagram. Almost the person, when they're just choking, you can see they're using the hand to hold the neck. And use the hand to hold the neck because the neck or probably pain already cannot down the foot. So normally the person you want to help, you must stand behind. Okay, you must stand behind. Okay, after that your hand, okay, both hands must hold below the rib. So that means the rib, tulang rusuk, the bottom there. Okay, just a little bit above the stomach. Okay, both hands hold it. After that, later you need to move the direction is go up. That means you want to lift the person up. Then this one person must be bent a bit in front. They must bend a bit in front. Then you help to lift this one person up. Keep moving up. Let the foot to come up. So from here, you need to explain this one hemorrhage maneuver actually is what? There's one emergency procedure. Okay? To carry out, you want to save individual when they are choking, when they are blocking. So that means you need to help. Okay, after that, the choking means what? Choking means when the respiratory tract, so that means your pernafasan, punya tract, okay, is blocked because of the food or the foreign object. Something is blocking at the middle until you cannot breathe. So this one is an emergency situation. If nobody help, they will die because the oxygen cannot go through the blood. Okay, so that means this one also is one of the things you need to learn. Okay, now we're going to see the hemorrhage manual. When you see the situation, okay, example, you see the somebody difficulty in breathing. Suddenly they eat, they cannot breathe. Okay, number 2, holding the neck. Cannot breathe already. After that, they're holding the neck with the both hands. Okay, after that, you can see the situation is, which one I'm going to hide first. Okay, the skin, the lips, the nail become black color. This one is very, very dangerous already. When this one situation happen, that means you need to help already. Okay, cannot breathe already. Maybe cannot breathe for some time. So the skin and the lips, the chain become black color. Okay, a little bit blackish. After that, they're holding the neck. After that, unable to speak and keep coughing. So this one is a very important situation. So when you see this one situation, so you need to apply the Humiliage manual. Okay, this process. So these 4 things actually, there's a situation, the symptom for choking. Okay, for choking. So from here, the Humiliage procedure. First, you need to stand behind. Okay, must stand behind the victims and bend his body. So the body must be bent a bit, cannot straight. Okay, after that, put your arm. Okay, your arm must be put around. This one is one person. If you got here, then you stand behind. Then your arm must be around the victims from the behind, go in front. Then after that, you need to clean and also the feet with your right hand and also place the right feet between the navel and below the ribs. Below the ribs. Okay, this one is the ribs. So normally it's between up ribs and also the stomach. Okay, so not at the bottom, it's the middle part of the ribs. Then after that, place your left hand on the top of your right fist. So left hand is above. Okay, this one is a right hand. Right hand, you make it become fist. After that, at the top is a left hand, cover the fist. Then after that, press in the rib part. Then after that, you do jerk. Jerk means you lift the person up. Okay, jerk quickly and also with force. You must very fast and also you need to produce some of the force lah. Okay, guna sedikit tenaga untuk naikkan dia. Okay, until the object is ejected from the victim's mouth. Okay, until you need to choke so many times. Check it up, check it down until the object from the mouth to come out. Okay, so that means this person victim, they cannot stand straight, into strain bending a bit, let the foot easy to come out. So this was a process when you do Humiliage manual when the victim is choking. Okay, so from here important, one you need to do like this lah. So the first one, sure you want to prevent death. Okay, prevent the victim's die. So you need to do the process. Okay, number 2, you want to prevent the blocking airway. So if you do like this, means the foot can come out, then the airway can be open. Okay, prevent the oxygen cannot lodge to the lungs. So you want to let the oxygen go. So the first step must let out the thing blocking. And the last one, you need to provide enough oxygen to the brain. So that's why you need to do. If they keep blocking oxygen for certain time, the brain cannot get the oxygen and the person will become abnormal. Maybe cacat already. Okay, or they fainted, cannot wake up. So this one is insufficient oxygen effect. Okay, so here they show you the step. First, and you see the person like this. Okay, using the hand, hold the neck. Okay, so the person you want to help, you must go behind. Okay, step 2, you must go behind. Then you see your hand is starting on the hold the victims. Okay, first, you call the victim bend a bit, bend down a bit. Okay, then you need to focus. Focus this one. Focus this one. This one is below the rib. Okay, not center. Below the rib a bit. Okay, so you're using your fist. Okay, your fist, this part. Okay, then you need to put this part fist to the rib there. Below the rib here. Okay, then another hand. This one should be the left hand. Put at the top. Okay, close the fist. After that, you need to jerk the person. Okay, hold tightly and jerk the person up. Then you need to keep jerk so many times, maybe 4 or 3 times. Okay, if they're still blocking, that means you need to continue to jerk until the blocking foot to come down. So this one is a procedure how to do the Humiliage management. Okay, so this one is got people to help. Okay, suddenly your friend can see you, then they can help lah. If suddenly the situation is alone, nobody surrounded, then you're choking. what we need to do. So we go and see. Okay, like this one situation. So important, this one, the chair can be help you. Okay, you take something is lower a bit. You are high, is it? This one is a halfway of your body. So this one, the chair must put in front yours because they want to help you, don't let you to fall down. Okay, they hold your body. So from here, we need to see if no one around, nobody around, when you are choking. So the best way to save yourself is to place your hand using your own hand, following the Heimlich maneuver. Follow the step for the Heimlich maneuver between the navel and also the below the ribs. So your hand must be put this location. After that, you try to exert the pressure to your parts, to the part you put in, okay, to the area, by bending the body. Okay, bending the body, then use your hand to jerk by yourself. Okay, if you're not enough energy, no energy, okay, you're very weak, your hand no energy, so you need to help with the object. So they say if no strength, find an object that's about the height of your waist. Okay, sampai pinggang. Okay, macam chair, proceed. So that means that like a chair, like the tables, then you bend forward, all your strength against to the object. So now you push, you want to jerk yourself up, is it? So the chair will support you, don't let you to fall down. So this is an emergency process you need to know how to do when you are alone. Okay, when you are alone. Okay, so this one is a process for the Heimlich maneuver when you are choking. Okay, now we're going to see this part. Okay, this one is one of the short video about the choking. Okay, how they do the Heimlich maneuver. Okay, I'm going to show.
I'm Brianna, and today we are going to discuss the things that you need to know if you find a person choking. This is Choking Charlie, who's going to help me with the demonstration. The universal sign for choking is the hands crossed at the neck. If they are coughing, then they are able to breathe, and you would not perform the Heimlich maneuver on them. In order to do this, you stand behind the person and make a fist with your thumb pointing back against you, midline between the belly button and the rib cage. Grasp that fist with your other hand and pull back and up quickly until the object is expelled or the person loses consciousness and needs to be lowered to the ground to begin CPR.
Okay, so from here, the conclusion, you need to remember. Okay, remember about the emergency help. We got two. One is a CPR, another one is a Heimlich maneuver. CPR, you need to know got two process. One is a chest compressing. Number two is a breathing. So you must know how many times you need to compress and also how many breathing you need to put. Okay, the whole cycle you need to put 5 cycles. After that, you wait the ambulance to come. If the victim's got breathing, then you need to turn the victim to the side way. Okay. So another one should be the Heimlich maneuver. If somebody is choking, so this one you need to know the step. Okay, stand behind. After that, your hand where you want to put. After that, you need to check the person. Okay, check many times lah. Depends the object. Make sure the object is come out. Okay, so this is the process. Okay, so if you don't have any question, so you can dismiss now. Okay, thank you everyone.
Thank you, teacher.
Thank you, teacher.
Okay, thank you.